And that's really where I got depressed myself. That's really where I got really upset. Because as it turns out, there's not a single study, not one study that suggests that being treated with antidepressants for literally any psychiatric disorder, but let's just talk about depression, results in improved long-term functioning or improved long-term outcomes, which is why we have a situation in the world today where depression is according to the WHO, the #1 cause of disability, and yet we have more prescribing of treatment than ever before, right? Shouldn't those be inversely proportional? Shouldn't we have more treatment and less depression? What happens when the treatment is actually inducing disability?
Hey folks, welcome back to High Intensity Health Radio. It's Mike Mutzel here. And I'm super excited and grateful that you're with us. And I think you're really going to enjoy today's guest. We're live with Dr. Kelly Brogan. She's the author of this new great book called A Mind of Your Own, which is absolutely fantastic. It launches by the time that you are viewing this podcast or listening to this over on iTunes. And the subtitle is What Women Can Do About Depression That Big Pharma Can't. And so this book is really empowering. It's really provocative. It's polarizing, but most importantly, it's loaded with really sound science. And we're going to explore some of that today. So Dr. Brogan, thanks for being here.
Hello, thanks for having me, Mike.
My pleasure. Super excited, like I said in introduction. Your book is loaded with science, but a quote that stood out for me was, before I had stopped prescribing, I never once cured a patient, which I think is really profound because you're a psychiatrist, board certified, triple board certified, I should say, in integrative medicine.
Very expensive process, yes.
Yes. So talk to us about that, because a lot of folks think that they go to the physician, whether it's family medicine or psychiatrist, get a pill and then they're cured. So tell us the backstory.
Yes. So I'm dyed-in-the-wool psychiatrist, totally conventionally trained. I don't come from any sort of new age, hippie-ish type of family. In fact, my parents are very doctor worshiping types of folks, authority-driven folks. And I was very interested in the promise that psychiatry, and my major in college was neuroscience, and I was very interested in the promise that we have cracked the code of human behavior and sort of dug into the minutia of all of the proposed science around the mechanism of a lot of these psychiatric drugs. But what I found, and what many of my colleagues find, is that we're really just trying to sort of get people back to work. That's what psychiatry is about. It's sort of to keep you functioning, keep you afloat, and to suppress your symptoms at any cost. And, in many ways, it can accomplish that. But I certainly never got to the root cause of what is a very, very non-specific term, right? Depression. And you could say that really for almost any mental illness label. These are not valid, heritable illnesses. These are not diseases. These are just symptoms. And our diagnostic manual is just, a dictionary of labels, right? We don't have tests that we do. In fact, most outpatient psychiatrists don't even run basic blood panels on their patients to rule out known reversible causes that we learn about in the hospital, like B12 deficiency, for example. So it wasn't until I really put down my prescription pad completely that I began to see what lifestyle medicine, holistic medicine was really capable of. I think that a lot of people who use lifestyle interventions like nutrition as almost a window dressing to the real treatment, which is medication, they don't ever have the opportunity to fully appreciate what it's profound, how profound this intervention can be. And so I spent a couple of years, adding fish oil and SAMe and maybe a little Rhodiola to my patients' Prozac and Zoloft and lithium. But it wasn't until I read an expose by Robert Whitaker called Anatomy of an Epidemic in 2010 that I began to encounter the unpopular literature, right? So this whole body of science that I never once heard a whisper about in my Ivy League training. So I began to dig deep into that, and I could no longer in good conscience start a patient on an antidepressant or any other psychiatric medication again. So that's when I began to really, cure patients. And my goal is to get them out of my office forever. My goal is to return the agency to them so that not only do they not need, chronic prescriptions for life, but they also don't even need me, because I've given them tools that are well within their disposal, and then they can go on their way and experience their life from a very different place.
And as a practitioner, that must be a lot more fulfilling than just constantly trying to reevaluate which medications they're on and so forth. Because I hear a lot of practitioner friends of mine say that the reason that they got in integrative medicine was similar to that story that you said is, patients were not getting better with the therapies that they were taught how to, prescribe and so forth. So let's talk about some of the therapies and really blow the lid off this myth that, the serotonin and norepinephrine and monoamine hypothesis of depression. You have a lot of great tables and charts and all the research there that really was mind-blowing for myself. I was writing a bunch of notes and looking up the references. I mean, talk to us about this, because a lot of folks, even functional medicine folks, functional medicine-minded, integrative people, feel that this, serotonin depletion leads to feelings of malaise, but there's not a lot of science showing that.
That's right. So this is such a prevalent meme. We have almost been, as a collective, brainwashed into believing it, myself included, obviously, for many, many years. And it wasn't until I took that deep dive I alluded to that I began to see sort of the bankruptcy of this model, right? What we're taught not only as practitioners, but that the layperson is also taught by direct-to-consumer advertising. We're one of 2 countries in the entire world that allows for that allows for pharmaceutical companies to speak directly to patients about their health. So, we are taught what, right? We're taught that depression is a discrete disease that is likely heritable, and that is the result of a chemical imbalance. Often, the theory gets a bit more specific, but usually it sort of treads lightly in saying that it's a serotonin imbalance specifically, right? So we don't have to scratch even too much beneath the surface, even on a common sense level. And then I'll just give an overview of what the literature shows. Even on a common sense level, we have antidepressants in this world that are approved that have exactly antithetical mechanisms, right? So a medication called Stablon, for example, is an approved antidepressant that is a serotonin reuptake enhancer, okay, by mechanism. Now, these medications do many, do myriad things. And of course, we only focus on one of their effects. But if we're going to be reductionist, let's just look at this. So we have Stablon that does that. And then we have Prozac, for example, which is a serotonin reuptake inhibitor. Okay, we have antidepressants like Wellbutrin approved that have very little or indirect effects on serotonin. Their focal impact is on neurotransmitters like norepinephrine and dopamine, right? We have trials that show comparable efficacy in totally non-psychiatric medications like beta blockers or benzodiazepines or thyroid hormone. So when you look at the question of whether or not these medications work, this is extremely controversial, but it sort of exposes the fact that the serotonin theory is a myth because they don't really work. Not only do they not work in the conventional literature, their purported efficacy something around 30%, right? That's not so hot. But if you actually delve into where that 30% even comes from, the way that, the world's placebo expert, Irving Kirsch, is a psychologist, has done in 2 very sophisticated meta-analyses, what he found was that when you include the unpublished literature, which, psychiatry loves its hidden file drawer, right? So it loves to hide the studies that have not been favorable, and there's a famous paper by Turner et al. That basically shows that like 37 of 38 negative studies used to approve 12 antidepressants were not published because they were negative, right? So, okay, so you have this phenomenon of flipping the coin over and over and over again until you get heads. But what he showed was that if you control for something called the active placebo effect, that these medications have negligible clinical efficacy, that they, in fact, are not to be separated from placebo. But what is active placebo effect? This is a really important concept because every time I lecture, I have someone in the audience who says, I don't care what you say, this medication has saved my life, or my friend's alive because of Zoloft, or, I don't believe it. There must be something more to the story. But the truth is that the active placebo effect is the recruitment, the activation of all of those bodily beliefs, right? Those encoded beliefs about you're being sick and there being a chemical fix, right? Where do we get those beliefs? We get them for the same reasons we're talking about, that we all have these beliefs about what depression really is. We've been taught by media, okay? So what happens when you're in a trial And you're told that if you get the treatment in this trial, you might get some dry mouth, you might get some diarrhea or headache. And then the alternative to that treatment is an inert placebo, like a sugar pill. When you start to have those side effects, guess what you tell yourself? You tell yourself, oh yes, I'm in the treatment arm, it's gonna work, I'm gonna get better, right? So before the medication can have any, primary effect, which we can also discuss, before it can even have that, it's activating the placebo effect, right? Because if you didn't have those side effects, you would know you were in the placebo arm. And I'll just touch on this briefly because I think it's an amazing study that came out like a year or two ago that looked at patients who were treated to remission, totally, per them, totally better with Prozac, right? And they were told, you're either going to be randomized to placebo or you're just going to be continued on the same dose that has cured you, right? That's gotten you totally better. Don't worry about it. So what happened was when they randomized them, both groups, the ones who took 40 milligrams on Tuesday and 40 milligrams on Wednesday, and the ones who also were randomized to a sugar pill, became depressed, lost all benefit. Both groups. So what does that tell you? What it tells me is that the power of belief, or what's called expectancy in the medical literature, is a really important factor here. And it doesn't mean it's in your head. The folks who are studying the placebo effect understand it's one of the most complex and really beautiful, symphonic, sort of messaging systems that exists in the human body. It's a very real thing. It doesn't mean you've been like fooled. It's not that. It's like a physiologic phenomenon as much as a psychological one. So when we look at these, sort of poke the holes in the efficacy piece, then we have to look at the long-term effects, right? And that's really where I got depressed myself. That's really where I got really upset. Because as it turns out, there's not a single study, not one study, that suggests that being treated with antidepressants for literally any psychiatric disorder, but let's just talk about depression, results in improved long-term functioning or improved long-term outcomes, which is why we have a situation in the world today where depression is according to the WHO, the #1 cause of disability, and yet we have more prescribing of treatment than ever before, right? Shouldn't those be inversely proportional? Shouldn't we have more treatment and less depression? What happens when the treatment is actually inducing disability and a chronic disorder that might have otherwise been a reversible or maybe single episode phenomenon? So, there's a lot that is, there's a strong signal that is calling us to re-examine this theory that depression has really anything to do with brain chemicals primarily. And there's a voice that's emerging from the primary literature that essentially supports the idea that instead it could be a body-wide, system-wide phenomenon, right? Mm-hmm. And that theory is called the Cytokine Theory of Depression. It's the area of chief interest for me because it takes it out of this dualistic model where it's like head up, body down, sort of subspecialties. And it just brings it into the realm of all other holistic medicine that looks at the mismatch of lifestyle with what over 2.5 million years our genes have come to expect. And it asks the question, what can we do to align these things a bit better so that the alarm systems in the body, inflammatory systems, immunologic mechanisms are not on a high alert constantly. So it's really a simple and relevant explanation, but there are many others because, depression is just it's like a fever. It doesn't tell you much about what the cause is, and it really doesn't even tell you much before you can personalize it about how to enter in to reverse it. So this is a very, very different way to think about it than psychiatry has for the better part of 60 years.
Yeah, beautifully said. I think part of the problem, Dr. Brogan, is when people are depressed. And speaking, I've had periodic bouts of depression, throughout my life and have never taken an SSRI or anything like that. But that sense of urgency to overcome this feeling of malaise and the brain fog and so forth, I think is really strong. So in my opinion, I'm not a psychiatrist, but that's why people maybe dive into the prescription approach as opposed to taking the long-term, doing meditation and Tai Chi and working on the gut and all the things we'll talk about a little bit later. Does that resonate with you as a practitioner?
I love this question. Yes. So here's the thing. we are sold a promise about this medication, right? We're sold the promise that it's going to fix it for you and get you back to work, right? The American way. And there are a couple of issues with that. One is that we love this idea. We love this idea that there's an effective, safe intervention. And I'm sorry to break it to everyone that that doesn't exist. It's an idea. I love that idea too. If it existed, let's talk about it. It just doesn't. So in lieu of that is the reality of what does exist, which is an ineffective and, in my opinion, actually quite dangerous intervention that I've just discussed is probably not going to actually get you where you want to go. And any practicing psychiatrist, even loyal to prescribing, would tell you it takes 6 to 8 weeks for clinical effect. So you can go ahead and start your Prozac prescription, but even a conventional psychiatrist would tell you don't expect much but side effects for at least a month and a half or two. So it's not even offering you what diet can do in 30 days, for example. Right? But the other more subtle issue I just want to put out there for people to chew on is like, why do we have so little tolerance, in this culture for struggle, for suffering, and for, and our own evolutionary process to be a bit messy. In every other culture, indigenous culture and traditional culture the world over, there is an appreciation that growth is not always a pleasant experience, right? And that growth comes through walking through a specific fire. It's absolutely a product of the way that we have been thinking about our health, the way that we have been trying to commandeer our bodies and dominate nature and focus on productivity and ambition at all costs, the way we've despiritualized, everything about the American way of life. It's a product of that psychiatry is the most powerful instrument that, frankly, not to sound conspiratorial, but that our government has, to keep us really in line. And so I'm actually a deep believer, more recently in my life, in the relevance of suffering. I think it has a point. I think there's a reason for it. And I think if you fight it and avoid it, like all of the great philosophers since the beginning of time have tried to share with us, it only makes things worse. So as a practitioner, or a healer, if you can hold a space, for a safe space for a patient to move through something, not only do they show themselves that they can do it, so they retain their agency, right? But then they also always, come to a place where they learn something about themselves, integrate something, get rid of something, shed something that needed to go, right? Think of all of the most difficult and horrific things that have ever happened in your life. And I'm sure that most of us can think of some aspect that we needed that to happen, some aspect that we've grown from it. So that's sort of like a subtext that is insidious, but the implication is that these symptoms must go, the conventional implication is that these symptoms must go away at all costs, and we don't care what they're from, we just need them gone. So, right, like we say in functional medicine, it's like taking, Tylenol every day for the rest of your life when you have a piece of glass in your foot. Like, how about take a look at what the pain is about, because there may be a meaningful, solution available to you if you're not just so focused on suppressing the symptoms.
Yeah, using it as a period of growth. And so part of all the thing, that whether it's obesity or diabetes, there's a reason why, an adaptive reason why certain things are still, within our gene pool, right? And so that's, like you were saying, like, use depression as a way to grow from it and reflect. And I was researching about in 2005, 2006, when I was having a low time in my life, like, why do people get depressed? What is the benefit of that? And I was, really surprised to kind of come about this evolutionary, aspect of it, like you just mentioned, which is really interesting. So let's go back to the remission. Untreated, non-medically treated depression versus medically treated. The remission rates 1 year later are dramatically different. Share with us that story.
Yeah, so they're above often 60%, in the earlier naturalistic studies that we don't even do anymore because we're so eager to medicate, right? We don't even know what the natural course of illness looks like because we don't allow it to unfold to even study it or learn about it. But in the earlier decades, 50s, 60s, even into the 70s, there are studies that looked at what happens if you don't do much of anything and you just let tincture of time, do its thing. And what happened was that the vast majority of these episodes were self-limiting, with 12 weeks being an average, duration, and they were not chronic, right? So now by definition, major depression is a chronic disabling illness. But what happens if it's not? And it's our very application of treatment that renders it a chronic disabling illness. So, listen, I have a sort of like, a doer fixer mentality still. I've evolved a lot in the past couple of years, but I still have relics of my conventional training in my mindset. It is not terribly comfortable for me to just sit by and let time do its thing. While I do appreciate that can be the most valuable thing, that sometimes doing nothing is much more important than just doing something that is, to be done just to do something. So my approach is to support, the process, and sometimes even aggressively support it. And in my experience, 12 weeks is even longer than is necessary if you move through it and you're not just focused on getting the symptoms gone, right? So in my practice, I'm not just interested in resolving the patient's insomnia or clearing up some brain fog or having them cry less or feel more motivated, to go to their job they hate. That's not really my focus as much as, I get very amped up about the prospect and possibility that I could enter in at a very critical moment in their life and facilitate a major transformation. So it's an opportunity when you're feeling hopeless, when you want to end your life, when you're feeling totally out of control, when you're feeling disconnected from everyone around you and from yourself. It's actually an opportunity to rejigger the whole thing, to strip stuff away, and in there is a seed of motivation that I present a sort of menu to, like, are you ready for this? Because this could be really cool. And so what happens is that my patients who come in and people say, oh, how do these patients do your protocol? It's so overwhelming. And, when they feel like they can't even get off the couch and they want to kill themselves, because we have a survival instinct and it just takes a seed of it to see the promise of something radically different. And I think when it resonates, it's sort of like if you had the flu and you couldn't even get out of bed, but I walked in and I told you won Powerball, like you would jump out, you'd have this reservoir unlock from somewhere and you'd feel differently. All of your symptoms, even if it was for 10 minutes, would disappear. So there's something like that goes on in my practice where, we connect in this space of promise for a different kind of life, right? Because most people these days, they don't just want to get back to work. They feel like they're missing something really important, missing a connection to something really deep. And so, I have patients when, we move through the initial stages, they leave their husbands, they adopt babies, they move to Europe, they have all sorts of radical changes. It's not always like a smooth transition, but it is coming deeper into their authenticity. And that's not something, in my opinion, that can happen when you are medicated. I think there are parts of your psyche that are made unavailable to you in ways that we can't predict or really even understand, such that this is a process that has to unfold in harmony with your body, not fighting it.
What aspect of your protocol or therapy would you say most profoundly contributes to this transformation? Is it the mind, body, spiritual connection, or is it the whole package? Is there any one component that is more effective or powerful than the other?
Yes. I just wrote a blog called 4 Archetypes of Transformation, because the truth is there are different, different things to lead with for different people. But I do think that the biggest category is the people for whom the nutritional pillar is the absolute game changer. I'm biased because, I was introduced to the power of this type of medicine through my own, struggle with Hashimoto's postpartum after my first pregnancy. And I changed my diet. I literally went from eating McDonald's, drinking Red Bull, and eating Snickers and Twizzlers every day, no joke, to first starting with a gluten dairy-free diet, focusing on sourcing and organic, and then moving into a more ancestral diet over about 2 years or so, completely not only changed my life and my body, the internal workings of my body, but it also then quieted so much background noise that I didn't even know was there. Like the fact that I like pooped once a week for 30 years and thought that was normal. And, a layer of forgetfulness and brain fog and, sort of like chronic racing heart. I just thought, well, that's how I am. It peeled all this away so that I was more free to sort of think and into and feel into bigger questions and bigger, sort of mind, body, psychospiritual stuff. That was the order of operations for me. It was like, Maslow's hierarchy, if you know what that is. It's like take care of the lower rungs of survival first, and then you can, move into the more apical stuff. And for me, healing my body was my entryway to a new way of thinking. So I really like that model. I think it's available to many, many people. So I start with a very simple 30-day, clean slate approach to diet that I'm happy to detail. It's not anything I made up. It's not anything really that revolutionary. It's basically just whole food. And then after that point, we sort of introduce, the diet that most of my patients land on is sort of like, if you want to get, labely about it, it's sort of like a moderate carb paleo diet. It's not a ketogenic diet. It's not, terribly strict, but for those 30 days, I like it to be, because it moves the needle. It moves the needle radically. And this is because so much of what we are calling depression or anxiety or even panic attacks, for example, is, simple stuff you know all about and speak about, which is, blood sugar instability, is chronic inflammatory response, is antigenic foods like, protein in proteins in wheat and dairy, for example, is nutrient deficiencies, right? Because when you're eating the way I was eating and the way a lot of my patients are eating, you're missing out on a lot. There's a really powerful case study in psychiatry that talks about this woman who was vegetarian for 27 years. And, the long and short of it is that she develops a psychotic depression and is admitted to a hospital with what's called catatonia, which is essentially as bad as it gets in psychiatry. She's treated with shock treatment and antipsychotics to no avail. She doesn't get better. So she's transferred to another hospital because this hospital doesn't know what to do with her anymore. And they check a B12 level. She's in the hundreds, her serum level. And they replace her by injection with cyanocobalamin, 2 injections. And not only is she completely remitted in terms of her acute symptoms, but symptoms that she had of sort of malaise for 14 years leading up to that episode spontaneously resolved. So this is how dangerous it can be to prescribe medications that completely miss the mark, completely sidestep the origin of symptoms that are really often tied to dietary sort of like derailments. Because the truth is we should know what to eat. We should know. We have that encoded. It's one of our deepest connections to the natural world is food, right? But we've strayed from the path. And so, often what I'll do is, I'll say, I'm recommending, that you eat pastured red meat, including pork, lamb, or beef, 3 to 5 times a week. How does that feel for you? Does that gross you out? Does it make you want to gag even hearing me say that? Or does it feel like, oh my God, I can't believe a doctor is telling me to do this, right? Because most of my patients have the latter reaction. But if they don't, and there's some, we can clear all the misinformation and gurus talking away and, the China study and everything else. We can clear that all out and they still feel like an internal revulsion. That's actually very important. And it changes how I implement even those first 30 days, because a lot of it is just about creating space for that internal preference mechanism to surface. And I certainly, by the way, don't feel, as a Weston Price fan, I certainly don't believe and don't think anyone should support the notion that there's one diet for every person. It is the most absurd concept that's ever been floated, right? And my work with my now late mentor, Dr. Nicholas Gonzalez, who's a holistic physician here in New York, helped me to understand how to contextualize the diet that I recommend as a template, which is a red meat, inclusive diet. into the broader spectrum. He had 10 diets, that he used for different metabolic types in his practice. And, he had patients with diabetes who ate a high carb diet and drank 6 glasses of carrot juice a day and put into remission. And then he had patients who ate fatty meat, 3 times a day and resolved their lymphoma, metastatic lymphoma. So there is a subtlety and a nuance. It's a beautiful pattern that reflects how we have grown up ancestrally in different ecosystems and environments. But people who are prone to depression, to struggling with things like hypothyroidism, autoimmunity, weight gain, these are often, night people. They're often more creative types. They have these traits that support the notion that they are likely to respond to this type of simple nutritional intervention.
Dr. Kelly, let's take a deep dive into the psychoneuroimmunology and talk about, kind of how food really impacts the brain, and maybe weave in a new topic that I know you talk about in the book a lot, and that depression and associated manifestations are linked to inflammation. And so how food via the gut is a conduit to inflammation in the brain. So why is this diet effective? How does this translate into reduced inflammatory symptoms in the brain?
Right. So here's where the great paradigm shifting discovery of the microbiome comes in, right? Because I think intuitively many of us know that our thoughts and, beliefs even can affect our digestive experience. We can lose our appetite. We can get diarrhea if we're feeling very nervous. We know that there's sort of like a brain down impact. I don't think we know how important it is. But we have just begun to learn that there is a gut up impact as well, right? So a lot of that has come from when we completed the Human Genome Project. We learned that we, were less complicated than a grain of rice. We had to start to look elsewhere to where it was that we outsourced a lot of this epigenetic expression, right? If it's not in our genes, it must be above them. So with the dawning of the relevance of the microbiome, we've begun to understand the importance of the most powerful impact that you can have on your microbiome, which is through your nutrition and sufficiency and efficiency of digestion, right? So there has been actually a good amount of research in psychiatry looking at models of depression, of course, in animals, which is sort of a funny concept in and of itself, but nonetheless, where they use something called LPS, lipopolysaccharide, which is a component of gram-negative bacterial wall. And they use it to actually inject in these animals to induce a model of depression. So what that should tell you is that, there is something about the integrity of the gut wall, and that if luminal contents have exposure to the immune system and circulatory system, that, the symptoms of depression may be induced. And that these symptoms of depression actually may have an evolutionary purpose, as you alluded to earlier, to slow the body down, to put you into social, isolation, so that you're not having sex and sharing community experiences anymore, for recovery from infectious insult, right? So that's what sort of how the literature depicts it. But a lot of researchers have really run with this, and they've looked at how, first from a pharmacologic angle, of course, they looked at how interferon treatment in hepatitis patients causes depression in them 45% of the time. So like 1 in 2 people who are treated develop, meaningful depressive syndrome. They look at how we can use anti-inflammatory drugs like Celebrex to resolve symptoms of depression. Why would that be? Why would it be potentially effective? And then there's a literature that looks at how inflammatory markers like interleukin-6 or TNF alpha, for example, those are the best studied ones, have linear tracking with symptoms of depression. So like the higher your serum markers are, and not that I'm necessarily recommending this clinically, because a lot of people ask me that, like, do you track these? But it's mostly academic at this point, that these relate in a linear fashion to the severity of depression, and that markers like CRP can actually predict it, particularly in women, can predict the onset of depression. So inflammation predates the clinical syndrome in women in particular. And so we understand that the most, the alarm signal, the chronic inflammatory alarm signal is almost always set off at the gut level. So inflammatory response, perturbations of the integrity of the gut wall lining, secondary to dysbiosis, to poor digestion. Sometimes, to layer in another factor, it can also be systemic from psychological stress, though, because there's a really cool study from last year that looked at people who just were experiencing psychological stress in the study setting, and they had mobilization of macrophages from their bone marrow that then fed back up to their brains to trigger inflammatory responses in their brains, without any direct involvement of the gut. So it's not always the gut. We have to embrace the complexity here. But we now understand that at least one of the ways that the gut communicates to the brain is through the vagus nerve. So the vagus nerve sort of takes like a survey of what's up in the gut and translates it to the brain so that the brain can perpetuate that message. And if there is an inflammatory activation, what happens is that persists in the brain itself. And we now even have identified enzymes like IDO, for example, and how the brain can, through its own immune system, microglia is really essentially immune cells, perpetuate a message of inflammation to bring behavior into a place that is adaptive for response, right? So some of what we see as like hypervigilance and anxiety, insomnia, a lot of what can come with depression. Depression is not often like weeping on a pillow, longing for death. For most of patients today, depression is actually like quite an agitated phenomenon. There's irritability, there's intense anxiety, but then there's feelings of hopelessness, sadness, lack of motivation, brain fog, weight gain, all the rest of it. But it's this blurring of these ancient mechanisms that were meant to help us out. And we can understand how these inflammatory messengers have different effects on the frontal lobe versus the limbic system. And it's compelling, it's a field that's growing. There's a couple of researchers who are doing some incredible work in this arena to try and elucidate the relevance of this. But what it does most is it decimates all of these false boundaries. Like no longer can we just talk about brain chemicals. That makes no sense. Mm-hmm. We have to talk about the relevance of these other systems, and by the way, also the endocrine system, to add another layer of complexity, when we look at this intersystem phenomenon. So I don't know about you, but to tinker with each of those systems independently, and even through supplements, to use immune modulating supplements and then gut rehabilitating supplements and then brain anti-inflammatory supplements and then hormonally balancing supplements and all. I would much rather use, to start with, these interventions that act with complexity that we don't even totally get yet, right? So what are those interventions? They are diet. They're also all the basic stuff: diet, meditation, and I recommend a specific form of meditation called Kundalini yoga, at movement. And then sort of setting the stage. So, circadian rhythm preservation and sleep integrity, setting the stage for sort of like some connection to what my buddy Alan Logan, who's a researcher, calls paleo deficiency, right? So, to rehabilitating on that level. We can't replicate it with our brains. We have to trust that if we just send the body this signal through these more ancient interventions, that it will take care of it. And it does, at least with my population. And I certainly don't know if this is appropriate for every single practitioner's model. Beautifully said. I like how you really summarize that there. But a couple questions came out there, Dr. Brogan. And is some of the mechanism, at least some of the benefit, of psychiatric medications, their anti-inflammatory effect? Because we know that statins have an anti-inflammatory effect, and that may be part of the reason why they are effective in the context of heart disease. So, I mean, I know we're not promoting antidepressants, but could that be part of the mechanism there? Yes. Okay. I hate to admit it, but there are actually several studies that suggest that several antidepressants, and actually even in one antipsychotic I've seen a study on, that they have the potential for anti-inflammatory effects. And so it could be that in some patients this is adaptive, right? So, when we're talking, I just want to clarify one thing though, which is that when we're talking about medication-based effects, we have to remember that these are drug-based effects, right? So in fact, I don't even really love the term side effects because they're all drug-based effects, right? And if some of them you happen to like, then you call it a benefit, but they're all drug-based effects, right? In the same way, particularly with psychiatric medications that, if you're a very anxious person and you take 2 shots of vodka before you head to a party, you may like and benefit from, your anxiety may benefit from the chemical effect of alcohol. But that does not mean that it is in any way resolving the underlying issue, nor that you have an alcohol deficiency, right? So while it might be tempting to say, well, this is how they're working and why they're working, and now we understand that this is an important element of their mechanism, the truth is we have more effective interventions that do not carry, the very morbid side effects that antidepressants do, including sometimes an impossibility for discontinuation of these medications. They're so habit forming. So obviously, I'm going to advocate for the sort of like physician oath, to first do no harm. Mm-hmm. It's the only ethical way to approach this.
Right. Yeah, I wasn't insinuating that people should.
No, I know, but it's a good question, and it's true. I have read that literature too.
Yeah, I was just curious, sir. It makes a lot of sense. But like you said, there's much more natural and effective ways to reduce the inflammatory response and realign the communication with the gut brain a lot better and effectively. But what was fascinating, there was a researcher from Max Planck Institute that you talked about in your book that he said, I think something to the effect, I might get this wrong, but within 2 to 3 hours of taking antidepressant-based medication, you're changing neurochemistry like dramatically. So that's pretty profound, and some of the research that you showed, this effect on neurochemistry persists forever, and that's why it makes it so hard to get off the medication. So kind of reinforces what we've been talking about this whole time, is focus on lifestyle first there, Dr. Brogan. So as we go to final questions, anything that we missed? I mean, there's so much here in the book, guys. You're going to dig it, a mind of your own. But Dr. Brogan, any final comments before we go to final questions that you want to share?
So this is not meant to be, like an expose that then gives you a mandate of what you need to do that is so complicated that you're left feeling like, well, now what? It's actually, a very positive message, and it's extremely doable. This is the book is meant to be, to put in your hands the tools that you need so that you don't have to meet with someone like me, and you don't have to deal with the fact that there aren't many folks like me around the world, because this is just bringing very common sense material to an arena that has neglected it. So while we talked a lot about the misinformation around psychiatry, the truth is that this is intended to be really sort of like tools for transformation, and very much something that should be exciting and empowering, rather than harrowing and overwhelming. just want to reframe that a little bit. In fact, I should mention that we actually chose to change the subtitle since you got the galley, Mike, to sort of reposition this. It's not an anti-psychiatry manifesto, and it's not sort of David and Goliath, me versus big pharma. It's really about creating some, awareness around something that already exists that's so exciting that it will make the existing model seem sort of confusing, right? So the new subtitle is the truth about depression and how women can heal their bodies to reclaim their lives. So that's really a reframing of what's in there, and sort of importantly taking away this binary, like, me versus the system, or, sort of rejecting psychiatry. It's not about that. If this resonates with you, these concepts, if you feel like a yes inside, then I think this will feel liberating, but it's certainly not for everyone. And I'm not interested in coercing anyone or fighting with anyone or proving anything to anyone who doesn't fundamentally already have that little grain of awareness inside that just needed a bigger megaphone.
Mm-hmm. Well, I would disagree with you. I think everyone should read this book, no kidding, because it's really the foundational framework for understanding functional medicine. And you could replace depression with asthma or anxiety or autoimmunity or whatever, because you're adding the framework there. So I know you're being humble right now, Dr. Brogan, but I really was moved by your book and the amount of science that you have there. And then the practical take-home message about what people can do, like you said, is very simple. It's very easy. Things that we should all be doing to optimize our space and time on this planet, which is great. So a couple final questions there. If I want to get to know you a little bit better, we want to know your morning routine. You're a busy physician. You have an undergrad from MIT. You wrote a book. You're a parent. You have 2 beautiful children. So talk to us about the first couple hours of your day. What does that look like?
So this has been the most important evolution of my personal experience because, like I said, I'm coming from the conventional model. I'm coming from a well, if I'm not going to fix it with meds, I'm going to fix it with supplements. And if I'm not going to fix it with supplements, I'm going to fix it with diet. I have a very sort of pragmatic mentality, and I really neglected the relevance of meditation for many years. I read all the literature, decades of it, talking about how 20 minutes of guided meditation can change your inflammatory signaling and insulin sensitivity and all this stuff. But I really didn't implement it because I was very busy. And that was the excuse that I told myself. So that's why I'm very passionate about what's called medical meditation or Kundalini yoga, because it was my entry point into changing my relationship to my own nervous system. So I'm very interested in the role of the autonomic nervous system as like a top-down modulator of everything else, from endocrine to immune to gut. And I think it's probably the most powerful intervention for me in terms of changing how I experience myself and how, I manage my health. I mean, I these days am very vigilant about food. So I'll tell you like what, I eat for breakfast, for example, but this has been really what moved the needle for me. So I, wake up at 6 a.m. I spend 45 minutes, believe it or not, because I almost don't believe it, considering I couldn't even make 5 minutes to do it, doing meditation and this specific style, which involves specific breath patterns and mantra. And it's very sort of like, there's parts to it that I follow every day. I don't sit on a cushion and like watch my thoughts. It's not like that. It's very involved. So I do that first. And then I, apart from sort of, the routine of getting ready and using highly non-toxic products for my, sort of like personal routine. I do dry brushing for like 30 seconds before I hop in the shower. On the weekends, I do coffee enema, 2 days a week before I, hop in the shower. And I do oil pulling in the shower. So the shower is like a focal point of a lot of stuff, sort of just like more tedious stuff. And then usually for breakfast, I keep it super simple. I remember being so amazed that it takes like probably 90 seconds beginning to end to cook an egg. So so many of us think it's gotta be something faster, but it's actually like one of the fastest things. And I'll just like eat it with an avocado, or I'll make a smoothie. I have this smoothie that I've put in the book and is on my website that I happen to really like. And it's basically just like a bunch of natural fats and some cocoa powder. Sometimes I'll make like a turmeric latte or something I'll take with me. So I keep it relatively simple. And then I commute and I do a lot of my reading before I get to the office. And I have this experience of always reading exactly what I needed to read that day, before I engage with patients. And that's the kind of thing that starts to happen to you, I think, when you come into a more meditative practice, is you don't experience stress. I don't experience stress at all ever anymore. And I used to be the most neurotic type A reactive person on the planet. I'm Italian and Irish. It felt like it was like bred into me. And because of my practice, I just like marvel at how things unfold, and I can trust the process, so I bring that type of consciousness to my patients' struggles, and it's contagious, but I think I owe my morning practice to that.
Yeah, it's pretty amazing meditation, what it does to your intuition. And like you said, that
Exactly.
congruence with the universe. It almost sounds like a little too woo-woo, but I can resonate with
Try
what
it
you said.
out, yeah, and you'll see. Exactly.
Yeah, really fascinating. So second question here, if there's one herb, nutrient, botanical, or whole food substance, just one that you could bring to a desert island, and that's all you could bring, vitamin D and omega-3s are covered, what would you bring with you and why?
Right. Yes, I think it would probably be turmeric or curcumin, in supplement form. I just have been amazed and inspired to see a body of literature, much of which is cataloged on agreemedinfo.com, that has helped me to appreciate the informational qualities of these basic foods. Because what this one spice, and of course curcumin, we're just talking about one of the active ingredients in turmeric, when the whole root actually has amplified effects beyond what curcumin even does on its own. What it can accomplish is like near magical. I think, you would never believe that a pharmaceutical could do all these things at once, right? So I think that's, if we're going to use, extrapolate from food as medicine and use it in sort of high potency form or supplement form, I think, that's one I'd like to have in my pocket.
Yeah, me too. Well, like you said, it deals with the networks. It's not just a one mechanism, it's multiple, which is
exactly.
Love that. So if you were to bump shoulders with someone from the World Health Organization or President Barack Obama or a future president in an elevator and had 30 to 60 seconds to share with them just one health tip or piece of lifestyle medicine, what topic would you want them to know about and why?
How we are, God, I could really get on a soapbox with those two folks. How we are creating a problem we may not be able to dig ourselves out of as a nation and even a planet by, in the American realm anyway, by subsidizing the food industry and big agriculture the way that we are. That if we just unchink, that piece of the armor, we will see a domino effect of resurgence of a health that we are entitled to as a people, that will resolve so many of our fiscal and even ideological conflicts today, that I think it's like we have blinders on about how big a problem that is, that level of enmeshment financially at the top down sort of level. So that's what I would want to bring some attention to before I talk about transparency in the research realms and disentangling industry and basic science. But I think I would ask them maybe, as like a personal trial, to see how they would feel for 1 week if they didn't eat any packaged foods at all. Just to sort of prove to themselves, like, how could it really matter? What would it really do? But we all know that if you take packaged foods out of your life for even 1 week, you feel like a different person. If you take sugar out of your life for 4 days, you can feel like a different person. So that would be sort of like my prove it to yourself challenge.
Love that. Beautiful. At least level the playing field, right? So that there's, equal competition between, natural growers and these big commercial growers, which I think you're saying there. So Dr. Brogan, I know you have a lot of resources on your website and a program too. Obviously you have the book, A Mind of Your Own, which people can get on Amazon. And as I mentioned earlier, can't endorse this book enough. It's loaded with fantastic information, but for people that want to take the next step, they want to learn a little bit more. Did you have some courses, some videos and ebooks and so forth?
Yes. So it just sort of worked out this way. It wasn't my master plan, but I have been working on a course for a couple of years, actually, amazingly, called Vital Mind Reset. And it's essentially because I get contacted from people literally on every continent, because there are not psychiatrists practicing there who do this work. And I actually force them to fly into New York to meet with me, because I think sitting with someone's energy is very important. And it's just crazy. It's ridiculous. And my time is very limited, obviously. So that I wanted to offer, what I ask people to do in the first session, and sort of like tailorable follow-ups in a course form. So that I could make waves, but also so that I could give people tools. So that's what this is, and it happens to really work as a companion to the book. It's launching in April, and you can find information about that obviously through my site and newsletter list, and through you, I think, right? So even you might mention it in today's links. But so that's really my intention, is to give sort of a companion continuation where I give it's a deeper dive. Obviously the book is just the first 30 days, but what then, type of.
Fantastic. So, well, folks listening, if you're driving or walking your dog or working out, doing all the things that we would love for you to be doing,
Exactly.
you can access to show notes and information, and also links to Dr. Brogan's book and the e-course that she's talking about at highintensityhealth.com/drbrogan. So, Dr. Kelly, really appreciate you coming on the show. I commend you for all the work that you put together, compiling all the research and then making it so practical and applicable for busy working professionals like you've done in this book. So, keep up the great work. We'll follow what you're doing, and really appreciate you coming on the show. It was fun to talk with you.
This was wonderful. Thanks so much, Mike. Your support means a lot to me. Thanks a lot.